Daniel Gafford is out with the knee injury, and we're going to break down what exactly he injured and when you potentially see him back on the court. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. So let's jump into the injury video. So Daniel Gafford, he's setting his screen, then they bump him with his right leg, and his right leg comes in towards his body. So whenever your leg comes in towards your body and he falls down, grabs his knee, we're thinking about several structures. So we're literally thinking about the medial structures, because if your leg comes in towards your body, we might stress those structures that are in the inside. And the structures that are inside, we're looking at the MCL, the medial collateral ligament, the meniscus, even potentially a bone bruise. Both those hit in the outside there when we stretch out the inside. But we're also looking at potentially the ACL. But there wasn't no twisting, so we're thinking more of that MCL. Because like I mentioned, whenever our body goes inward, we need to look at all those things on the inside that might get stretched out. So after MRIs, they said that it was an isolated MCL injury, which is the good news. But we're going to break down what MCL is and what his rehab's going to be looking like. All right, guys, so let's break down what the MCL is. The MCL is the medial collateral ligament, and it's located in the inside part of your knee. It connects your femur to your tibia, and it provides stability to your knee. Because it's attached to the inside, it prevents external forces from stretching out the inside part of your knee. And that's very important, because that's what happened with Daniel Gafford's injury. His leg came in, they bumped him, his knee came in, his MCL was supposed to hold that, but it tore because there was too much of a force. And that's normally how people injure that knee, is there's a valgus force, a force going to the outside, stretching out these ligaments here. So whenever we have a sprain of the MCL, we got to take a look at it. The MCL is a little different from the other ligaments, that there's two main layers of the MCL. We have the superficial and the deep layer. And those layers dictate on the severity of the injury too. When we have a deep layer injury, that attaches to the meniscus. So a lot of times that people tear their MCL, they will also tear their meniscus. But lucky for Daniel Gafford, it was an isolated MCL tear, and it was a grade 3. And we'll kind of break down the grades. So with the grades, whenever we sprain or tear a ligament, there's grade 1, grade 2, grade 3. Every time you sprain it, it's partial tearing. So grade 1, there's minimal tearing. Grade 2, there's a little bit more tearing. Grade 3, we have a lot more tearing. Usually grade 3 requires a lot of surgery for other ligaments, but because the MCL has good blood supply, it usually heals on its own. But depending on the instability, some people might have surgery. For Daniel Gafford, he's going the non-surgical route. So when we go on the non-surgical route, we want to really focus on getting stability back in the knee. One, it's going to be a little painful, but early on, they want to get their knee pretty straight to allow that ligament to heal. Because the more we bend it and the more we do movements rotating side to side, it's going to put more stress on that MCL, and the knee's going to feel a little loose. In regards to his injury outlook, they're saying he's going to be out for 6 weeks. I think it's going to be a little longer, especially with the grade 3 MCL tear. Look for him to go back with a brace for sure to provide some stability. But normally from the athletes we've seen, it takes around that 3 to 4 months to go back, because that's a big tear and people have trouble with the stability and pain on the inside. But maybe they're going to reevaluate him in 6 weeks. I think that's what they meant, but I think he's going to be out for at least 2 to 3 months minimum. But let us know what you guys think. If you guys want us to cover another player, comment below. And if you guys have any questions regarding MCL injuries, comment below. And if you had an MCL injury and need help with your rehab, send us an email. We work with people in Southern California and online. So follow our channel, share with friends and family. We are the Basketball Doctors. Let's ball for life.